It's exactly 5 minutes past the hour of 11, and I say welcome to the issues where we talk about matters that concerns our community, our nation, matters from all around every facet of life. And you know how we do it every Thursday, where we dedicate Thursdays for healthy conversations, and this is in association with Ikorodu General Hospital. This is how we do it every Thursday, where we learn and unlearn, of course, when we talk about our health. They say health is wealth. And that is why we've deemed it fit to ensure that we talk about healthy conversations every Thursday. My name is Adebambo Opemi, welcoming you to the issues. And of course, today we will join the rest of the world. Some days ago, precisely 17th of this month of May, the world actually set the 17th of May aside as a day to celebrate the World Hypertension Day. This is to orientate the public. This is to create a proper awareness to not just Nigeria, but all over the world. Being the 25th day, it is still not bad for us to mark this day, talk about the 17th day in the month of May that has been set aside as the World Hypertension Day. We would have this conversation with Dr. Lookman Kareem, all the way from Ikorodu General Hospital. He happens to be the director of a clinical service and training, that is a DCST, and at the same time he is also a consultant cardiologist. I want to say very beautiful morning to you. Good morning to you, Dr. Lookman. Yeah, that is the voice of Dr. Lookman Kareem, just like I said earlier, the director of clinical service and training, Ikorodu General Hospital, and of course he's also a consultant cardiologist, where we talk about the World Hypertension Day. And for this year, the theme happens to be control it and live longer. Control it and live longer. First of all, I would like to ask you, but before my first question, for our listeners at home, you can join this conversation from anywhere all over the world via our website, www.ikd1061fm.ng. We're also very much available on Radio Garden, IKD1061 FM. And just like I told you today, we continue to orientate the public about this deadly disease called hypertension. High blood pressure in some cases, whichever way you decide to call it, they still mean the same thing. So I'll come to you, Dr. Lookman. When we talk about hypertension, medically, how best can we define or explain the word hypertension?
Thank you, Bambo. Good morning once again, our listeners. Hypertension is basically high blood pressure. Everybody has blood pressure. When it is higher than a particular limit, we'll say the person has high blood pressure, which is also termed hypertension. Hypertension is defined by a blood pressure of more than 140/90. When we take our blood pressure at home, we'll see there are three values on the device. The first is the systolic, the middle is the diastolic, and the last one is the pulse rate. So the first one must not be more than 140.
Okay.
The second must not be more than 90. If either or both of these values are more than the said values, 140/90, then this person is hypertensive, has high blood pressure. Of course, it will not be just a one-off measurement. It has to be consistent, persistently elevated values. Occasionally, somebody has just run some few meters, you come back to check, you see this blood pressure is high. However, if it is persistently more than 140/90, you say this person is hypertensive or has high blood pressure or has hypertension.
I think that is well explicit enough. I want to say thank you for that. To start up the conversation properly today, originally we do this towards the tail end, where we take some of these questions and contributions from our social media. But then one question someone asked when we actually did the publicity on today's conversation, the first question this person asks is, why do we, in quotes, celebrate Hypertension Day? You know, maybe I'm trying to assume the person is wondering, there should be an orientation not to celebrate hypertension. So how can we tackle this person's question?
Yeah, very, 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 very nice question. Really, we are not celebrating hypertension.
Okay.
We are campaigning for people to be aware of this killer disease. It is the number one killer disease in the world.
The number one.
Number one. Because if you look at it, gone are the days that we say the killer diseases are infectious diseases, including polio, diarrhea, cholera. But now we talk about cardiovascular diseases, including stroke, heart attack, kidney disease. And we know this disease, as bad as they are, the single most important risk factor for this disease is high blood pressure, hypertension. So we are not celebrating hypertension, we are not celebrating diseases, we are creating awareness. Because importantly, hypertension is a disease that is largely asymptomatic. You won't know you have it. That is why the theme for this year's celebration is measure your blood pressure adequately, accurately, control it, and live longer. So the point there is that we are trying to ensure that people are aware that there is a disease. See, as much as it's a killer disease, it is highly preventable and treatable, manageable. You see, something that can kill, that can be prevented, that if it has occurred, that can be very well managed with minimal, very little amount of money. So this is how we are creating the aware, and it is not a disease that will tell you, that will announce its presence. The only way it does that is by bringing in complications, which can affect major organs in the body, including in the brain, where it will cause stroke, in the eyes that can cause blindness, in the heart that it can cause heart attack, in the kidneys that can cause kidney disease that will require ultimately transplantation, or the person will not have to do dialysis. That will require a lot of money weekly. And the average in Lagos State now, to have dialysis one session will be about 50,000 naira. Wow. And for somebody to now live with that, we have to do it 3 times in a week. In a week. And who can afford that kind of money in this kind of the economic situation we are in? So this is what we are talking about, high blood pressure, that people should be aware there is a disease that is right in our sitting room. There are things, and it is also a disease that comes with our lifestyle. That's another important reason why we are telling people. So what we are saying is that we should live our lifestyle in a way that we will not be hypertensive if we are not yet hypertensive. If we are hypertensive, we will live certain lifestyle that will enhance, that will help the medications to work, and they reduce reduce the getting to the having the complications. And that is why we are celebrating this. We are not celebrating the disease, but we are creating awareness. People will be aware that this hypertension is like I said, if you have malaria, you have fever, you have headache. Hypertension is not something that, as you are sitting, if you don't measure it, you won't know you have it. Some will say, when I have headache is when I know that my BP is up. No. A number of times people will not know. We have seen in our hospital here, if you have 10 admissions per day, 4, 5 will be from stroke. Wow. Patient have stroke, and a stroke patient, nobody knows who will live, who will die. We have seen people being brought in from this tricycle, Marwa. This person is well dressed, set up to go to an event, and at that, while in the tricycle, it's when the person now collapsed. You understand that kind of a thing? We have seen people in churches and mosques, they are praying, and that is when they will collapse.
It always comes
unawares. So, and it comes with the complications. Some people, we have seen people driving on the road, while at the steering, the person will this traffic light will stop them. To move on, the person is dead. Of course, this is Nigeria, this is Lagos. People have a lot of things they time it. Okay, this is witchcraft, it is this, that. But this is not actually like that. What we are saying is there is a killer disease that is so rampant. As we speak now, the figures that we have indicates that to put it at the best, 1 of every 3 people is hypertensive. People more at the age of 40 and above. If we are 3 here, and all of us are more than the age of 40, we can say that 1 of us is likely to be hypertensive. Wow. So it is right with us. Wow. So, and like I said, until you have measured, you cannot know whether you have or not. Measure it, control it, and live longer.
Thank you very much, Dr. Lookman Kareem. I would like for us today on the issue... Kareem, pardon me, please. I would like for us today to talk about some of the causes of this number 1 deadliest killer disease called hypertension, and I would like for us to talk about some of the solutions at which we might cool it down a bit to some extent. But before then, when we talk about hypertension, a lot of persons, just like you have rightly said, when it happens, they just say it's a spiritual attack, and a lot of stories will just come afterwards. The next question I would ask you, when we talk about hypertension, who are those that are most likely, before we even talk about the causes and all that, who are those that are most likely to find themselves in this situation, having this deadly disease called hypertension? We believe it is said that it is for the aged people, 50 and above and all of that. How true is this?
Yes, really, it is something that usually occurs in people that are 40 years and older.
Okay.
However, we have seen it in younger people.
Mm.
When it occurs in younger people, to a number of times, we call it secondary hypertension. That means that there is another disease this person has that is now predisposing the person to being hypertensive. For example, the commonest you have seen is people that have kidney disease. We say kidney can be a cause, or kidney disease can be a cause or a consequence of high blood pressure. So kidney disease itself can cause high blood pressure. High blood pressure can also damage the kidneys. So this is one. Then we say that endocrine organs, like someone that has a thyroid, a very large goiter, thyroidosis. This person can also be hypertensive. These are secondary causes of hypertension. These can occur in young people. Wow. You see an 18-year-old, a 22-year-old, a 15-year-old with very high blood pressure.
You said 15.
15-year-old.
Have there been any cases of a 15-year-old?
Yes, we see them.
Wow.
Especially, like I said, people that have a kidney disease. One recent event we have seen are people that abuse substances. If younger people now abuse substances, they are likely to come with hypertension.
The tendencies are high.
Yeah, that they come with hypertension. We have them. We have beat them that way. I see the level very high. When we manage, but for when in control, we are able to get out of the substances of abuse. Then they get better. So these are causes of secondary hypertension. To mention also pregnancy. People that are pregnant. Pregnancy comes at younger age than 40, 25, 26. That's when women will be pregnant. So with pregnancy, somebody can be hypertensive. When it is not recognized and adequately managed, it can lead to convulsion during pregnancy, and sometimes the woman may even die with the pregnancy. So these are causes of hypertension. And I have to also say here, when I say substance of abuse, people will assume I'm talking about alcohol. Fine. Other drugs of abuse, marijuana, and the rest of them. But then I have to also call our attention to the fact one of the causes of kidney disease that also result in hypertension are drugs that should be of prescription that we take just anyhow.
Self-medication.
All these painkillers that we take, they can also damage the kidneys, and they will now eventually result in high blood pressure. Ibuprofen, because I work very hard, I have body pains, I don't have to see my doctor. And in our setting here, people have chemists around. They are just at their doorstep. Take this, take that. And a number of times they will give them different drugs, the same drug, under different trade names. This drug is ibuprofen. A company will call its own Ibumod, Ibucap, Ibudu, Ibuda. Somebody will now combine all this and swallow and the pain will get out, but then it will leave another telltale sign on the kidneys. So these are causes of hypertension in younger people. However, for those that are older, it is likely that a 40-year-old or older person will get it when either or both parents are hypertensive. They are likely to have it. My word that you should underline is they are likely. It is not compulsory that if my brother has hypertension, I should be hypertensive. But it depends on the lifestyle, which we will talk about shortly.
Yes.
Then if this person, the lifestyle is not adequate, somebody takes alcohol, smokes cigarette, eats indiscriminately. This person takes a large amount of salt in meals, and also depends on highly processed food from restaurants here and there. This category of people may be hypertensive. So what we have said is that likely for those that are 40 years and older, it can actually come with they can have it, but their own is what we call the primary type of hypertension, not the secondary type. When I say high amount of salt, people will wonder, I don't take salt. But then there are things that we consume. They do not necessarily have to be salty, but they contain high amount of salt. One of these are these junks that we take, things that are made of flours. Donuts, meat pie. The flour actually has a high level of salt, but it do not taste salty. They will rather take sugary, so we have to be careful.
Thank you so very much. If you're just joining us, it is The Issues on IKD 106.1 FM. And today with me in the studio, I have Dr. Lookman Kareem doing justice to the conversation. We know that the 17th of May happens to be a day set aside for proper awareness and orientation on hypertension. That is the World Hypertension Day. And that is why we have this conversation again, to create a proper awareness. So you can also join the conversation later on during the issues. I will open the phone lines if you have questions whatsoever to ask my guest today, my doctor, Dr. Lookman, in the studio. You would have the opportunity to call on our studio line 0904081161 or 0904082161. before we talk about the causes, in clear terms, you've done that to some extent, but in clear terms, before we talk about the causes, I would also like for us to talk about when we say control it, live longer. That is the theme for the year. What exactly are we talking about?
Yeah, thank you. The theme for the year is measure your blood pressure accurately.
Measure your blood pressure accurately.
Control it and live longer. Measuring the blood pressure accurately. I cite usual examples like when you are taking your blood pressure, it should be adequately measured and accurately measured. Because people go to different places to check their blood pressure. Now, gone are the days that we solely rely on this mercury thermometer that you have to pump, and so that is strictly for healthcare professionals. But now we have digital devices. However, this has to be regularly calibrated. And taking your blood pressure in places that are not certified. Because I have had a client that was actually supposed to be traveling somewhere, and in the garage, somebody came with a device and said, I'm taking your blood pressure. And the person was also shaking the head. And the patient was very terrified. At the end of the day, he said, your blood pressure is very high, run to the hospital. When he got to the hospital, instead of telling us that, oh, this is why I have come.
Exactly.
All she said was, test me. Of course, we ran a few tests until she now said it. Of course, she has missed it was actually in the garage for a luxury bus to travel to the east.
She was on a trip.
Yeah, on a trip.
Wow.
And she has missed that opportunity of traveling that particular day.
Wow.
So this is why we say you should go to designated places to check the blood pressure, not just anywhere. And you should go to a place that you will now not be. You are not going to be. They will not instill fear, unnecessary fears in you. It is something that is largely controllable. So when you measure, you cannot know that you are hypertensive until you have measured. Gone are the days that you say that I have never been to the hospital before. You can come and say, doctor, I don't want to check my blood pressure. That's fine. When you do that, whatever the value is, they will tell you. If you need to see us as cardiologists, you need to do certain things. You'll be told. That's why when you measure, control it. If you don't have high blood pressure, there are certain advice that we're going to give that will now ensure that you don't become hypertensive in the near future. So that is why I say measure. That is the first thing.
Yes.
And for the Nigerian Cardiac Society, part of the slang for this campaign is we say know your numbers.
Know your numbers.
Know your numbers. If I ask you what is your number, I'm sure you say 080. No, we're not talking about your phone number. We're talking about know your numbers. You at least, if I can tell you boldly, my BP this morning is 110.72.
As out of this morning.
This morning, that is my number.
Wow.
My weight is 60. That is my number. My height is 1.68. That is my number. My cholesterol is 5.08. That is my. I am aware of these things. If you are aware of these things, then you control them. You live longer. We don't want a situation that you will now say that, oh, I don't even want to know. I saw somebody recently. We checked the blood pressure and was actually very high. And I said, well, we're going to control this blood pressure. Well, that's another important point I have to say.
Yeah.
Hypertension does a lot of harm, but then it does not just come alone. It has partners in crime. Those partners include diabetes, type 2 diabetes, diabetes generally. They include being sedentary, not physically active, not exercising. You know, the days we are now, days of technology, you can actually be in a room and do everything from right on your bed.
True.
With remote, with a computer, you can even work very hard on your bed. Then you are only working remotely. So we are saying these are the partners that when hypertension is there, we check for the other partners that will come together to now cause the harm. I have said diabetes is one of them. I have said high cholesterol in the blood, or high lipid in the blood, or we say fat in the blood. When they are very high, they come together with this high blood pressure to cause this harm. Then we have said being very fat is another thing. We say it is not. You look at the days that we say you must have pot belly before you are recognized as a rich person or a wealthy person. No, the way to be in charge is to know your numbers. So I want us to keep this know your numbers.
Know your numbers.
What is your blood pressure? You know it. Okay, my blood is fine. Even what is your number? My BP used to be 160, but I'm not fine because I'm taking my medication. What is your weight? You know your weight, and you're controlling it. Oh yes, I'm aware my weight is this, and my doctor has said within the next 6 months, this is my target. You know your number, and you control it, and that is our team for the year.
Thank you so very much. The issues on IKD 106.1 FM. We're talking about hypertension. the deadly disease. And I want to say thank you so very much. I must tell you, I am learning. I also wish I could know my numbers, just like you have said. But unfortunately, I have just one of the numbers I don't know, and that is for the high blood pressure. But for the height and others, I think I still we have something in common, anyways.
Okay.
So let's now talk about some of the causes of hypertension, because there are always reasons to these things. And I also agree to the fact that you mentioned that this killer disease always come with partners in crime. Truly, you would hear people when they tell them that you have diabetes and hypertension. There's always a and to the story. So tell us, as a doctor and with the wealth of experience you have in this field, what are some of the major causes that you meet with on a regular basis when we talk about hypertension?
Thank you very much. When it comes to hypertension, we don't talk about causes. We talk about risk factors.
The risk factors.
Yes,
Okay.
things that you may likely have, or you do, that will make you to be hypertensive.
Okay.
So it is a multifactorial thing. It is not something that you can identify a particular thing that will cause it. I said a few of them a while ago.
Yes.
One of those is that when either or both parents are hypertensive.
So it's hereditary. It could be.
It could
be hereditary.
Let us say you and I are identical twins. We look so much. That means we share the same gene. We have the same parents. And either or both of our parents are hypertensive. If I live an unhealthy lifestyle, I take alcohol, I smoke, I don't work out regularly, I eat a lot of junks, it is likely that somebody in my shoes may be hypertensive. You that you don't live healthy lifestyle, you don't take unhealthy diet, you watch the amount of salt you put in your mouth, you don't take junks, you don't take fizzy drinks, it is likely you will not be hypertensive. You see, when we say this, I don't want to say this hereditary, but it can actually fall, it can run in the family. If you understand that, if it runs in the family and you live a healthy lifestyle, you may not have it.
So our way of life also matters a lot.
And that is what a major factor in prevention and treatment of this disease. And again, like I said, even though somebody can say, well, my parents don't have hypertension and diabetes, I've seen somebody that said, oh, my father lived up to 105 years of age. Why am I hypertensive at the age of 45? Yes, it's because the healthy lifestyle that our own parents and grandparents led, we are not living it now. So if your parents are not hypertensive, doesn't mean you will not be hypertensive if you live an unhealthy lifestyle. Now we are talking about the primary hypertension.
Yes.
The one we previously referred to as essential hypertension. We don't say it's essential anymore. So it can run in family. That is number one. Number two, unhealthy lifestyle, like I said. Consumption of a high level of salt in food. And I've said that it doesn't have to be necessarily salty when you put it in the mouth. There are some food that have been identified to actually contain high amount of salt. And I said processed foods, all these one in cans, because they're going to be preserved in salt, so they have a high level of salt content. Anything made of flour, our usual snacks, they have high level of salt. If you do less of this, it is very likely the person will not be hypertensive. And I've also said not exercising regularly, being very big. Someone that has diabetes is very likely to be hypertensive as well. The one that is very big in size, that is very fat, as we say, is likely to be hypertensive. These are some of the risks for high blood pressure.
Is it fine to say there are symptoms that one should look out for when we talk about high blood pressure or hypertension, which is almost the same?
Yeah, thank you very much. Yeah, yes, it's fine to say what are the symptoms of hypertension. But then it is now the direct answer to that is that hypertension is likely asymptomatic, does not have any symptom.
Wow.
That is why we say
hypertension has no symptom.
No symptom. And that's why we say it is a silent killer. Something that is there with you, that will not tell you, it does not announce its presence, and is ready to kill. So, and that is why we are saying the only way out of this is check. If it is not there, ensure it does not come. If it is there, then get it treated, get it managed, get it controlled. So it is largely asymptomatic. Somebody will say, "But I have high blood. When I have a headache, my BP must be high." No. Or when I feel palpitation, when my heart beats fast, that means my blood pressure is high. No. It is largely asymptomatic. We have conducted a series of medical outreach in the last few months, and we have seen people that are actually in the trade fair, in churches, in mosques, and they have a blood pressure of 240, 120.
240.
Quite high, and they are not even aware. And when you tell them, this is not possible. I personally saw somebody. I said, this people is very, I'm going to admit you. Say, doctor, I'm on my way to a meeting. I just came to check. So I wish I had not checked. Even if you are not checked, maybe you'll be somewhere that you will not even like. So high blood pressure, to say it is largely asymptomatic. The only way to know, that is why we say know your numbers. The theme for this year's celebration is measure your blood pressure accurately, control it, and live longer.
So I would ask you, is it possible, because some people will tell you, when you tell them you are hypertensive, they'll tell you, no wonder it started since last month or last year, because that was when I discovered a change in my system. Is that also a valid statement to say?
It is not likely there will be any change in the system. It is very unlikely. High blood pressure is something, of course, like I said, blood pressure is part of our lives. We always have these pressures there. It is when they get above a particular level that I will say it is already high. Majority of our people who know, they will have symptoms when they have a complication, one complication or the other. Okay, just like with the first question you asked, why are we talking about hypertension? It's because it can affect 5 major organs in the body. 5 major organs. And these organs, you also call them 5-star organs. Because these are organs that you cannot do without. If one of the organs is out, there is a problem. So, and that is why we are saying that if you are hypertensive, you don't watch it. When these organs, you only feel symptoms when these organs are being affected. Somebody, I work in a hospital that we have very large turnout of clients, and somebody will be brought in unconscious. You understand? And the person only wake up to see that they cannot move the right side of the body or the left side of the body.
Partial stroke.
No, not even partial. No stroke is partial. It's full stroke.
Because we used to hear partial stroke.
He's only a stroke survivor.
Okay.
You understand?
Okay.
Stroke is stroke. This person is only a survivor. You understand? When we can use that term partial stroke is where we call something TIA, transient ischemic attack. The stroke will strike. That word is actually well chosen. The stroke will strike. So after having striking, you will now see that within hours it will resolve completely. And such clients, if they don't come immediately within 3 months, they may have a terrible stroke. So if you refer to that as partial stroke, fine. But then stroke is stroke. We can only have people that have had a stroke and are now survivor. And some of them can survive without any residual weakness. But a large number of our clients will survive with residual paralysis. You see, the hand or the leg may not function very well. So it is not partial. And every stroke is dangerous. So that is one organ that can be affected. Another major organ that can be affected is the eyes. The eyes. Wow. It can cause, one of the causes of blindness is hypertensive retinopathy. And when that occurs, at the point of that terrible, that's why some people say, well, the only way I know my blood pressure is high is when I have blurry vision. No, you understand? It is already causing complication. Another one is the heart. It can affect the heart in several ways. It can cause direct heart failure. It can cause what we call the heart attack. That the person has sudden chest pain, and you see the person may just go down and die. You understand? People are very familiar with that term angina. Angina is just one of the siblings of heart attack. It is the earliest symptom. You see, heart attack has symptoms, but hypertension that will cause the heart attack does not have symptoms. So the one that I want to be in charge of visual health will now know that I have to monitor if I have high blood pressure. So I don't want to even feel the symptoms of heart attack. So I will measure my blood pressure accurately. I will control it so that I don't have heart attack. It can also have what we call arrhythmia. The beating of the heart is supposed to be regular, one after the other. Will now have something very irregular. So that might be the first thing I'll bring the person to the hospital. But then this person already has hypertensive heart disease. That is not a complication of hypertension. And the one we know very well is the kidneys. The hypertension also affects in Nigeria as we speak today. The number 1 cause of kidney disease is either hypertension or diabetes. You see, so the one that will come and tell you that the only way I know that my blood pressure is high is when my urine starts foaming. The person already has kidney disease. And we know that before you, even diabetes, before that time that the person start getting leaner, and they urinate more than 5-6 times over the night, and more than that during the day, they would have had a diabetes long before, at least 5 to 10 years, long before they will now become symptomatic. You see, know your numbers. So most of the disease would have been in the body. They are in that case, they are in the subclinical phase. They are asymptomatic earlier, but then they are there. If you make attempt at knowing your numbers, know your blood pressure, know your blood sugar, know your cholesterol, the numbers of the cholesterol in the blood, know your weight and height. These are your numbers.
It helps you stay safe.
To stay longer.
Ignorance is another thing I must tell you, because
and that is the baseline. Gone are the days that you say, like you rightly said, if you go to, like, we work for the government,
yes,
why do you have to tell lies if your BP is normal? You understand? So when you come,
it's
I will
not
identify
if you need something from them or whatever.
Yes. When you come, when I ask all the series of questions, okay, I will also ask you, what kind of work do you do? So you understand? I just want to know how much you move around, how much you exercise. You are an executive in a very big company. All you do in the morning is just to drive to the office, and for 8-10 hours you will not even leave your seat. When you get home, the highest movement you do is just to enter the bedroom. Every other thing is on the bed. Then you are sedentary. So this is a risk on its own. You will get bigger, hypertension will come, diabetes will come, and that is why we are saying again, know your numbers.
So from our social media handle, I would like for us to take this other one. This person is asking a question saying that, is it possible for doctors to assume if someone is hypertensive? The reason perhaps is because naturally they say that in some cases the doctor will just look at you and say, it's like you have hypertension and all that. Is it possible for you to just look at someone and just scan the person? Like, for instance, you are here right now and you're looking at me. Can you just scan me and say, Adibambo, I think something is wrong somewhere? Does that happen?
No. Nobody can know. The only thing is, if one of my doctor calls me and says, that's also person on admission, what are you managing for? Say stroke. I will, so of course, this person has suffered one of the complications of hypertension. So definitely, this person is likely to have hypertension. Apart from somebody that comes with a complication of hypertension, you understand? If I see you, if I see you and your parent, I will know this is your father. You understand? So if you see a complication of hypertension, I will say this is caused by hypertension. But I will now be in a gathering or maybe in a church or wedding ceremony. I will now say the pastor there is hypertensive. That's a imam. It's no. It's not that way. So the only way to know is to measure. I even as a doctor, I have to measure. Again, we said being fat, being big, is a risk factor. That is why you have to underline that word. Is a risk factor to hypertension. You understand? So not everybody that is fat will be hypertensive. Okay. Again, that is why we still have to measure. We said it's common in people more than 40 years of age. So I will not say everybody that is 40 years and above will be hypertensive. So I still have to measure. So check your numbers, know your numbers, check. Measure your blood pressure accurately, control it, and live longer.
The last question from our social media before we return back to the major conversation for today. This person wants to know, is hypertension curable? I also would have asked because we have some deadly disease that are curable. So is hypertension a curable disease? Can we cure hypertension and this person is totally free from hypertension? Or we can only manage it?
Thank you very much. That is the last word. That is your last word is actually the actual thing. It is not curable, but it is highly manageable and controllable. You can live. I have a client that I saw about 3 years ago. This person is about 70 years of age, and if not that he told me that he's been hypertensive for close to 30 years, I would not have known. When I measured the blood pressure, it was very fine. He said, an old man like that, and he said, "Doctor, do you imagine I've been taking this drug for the past 28 years, and it's very fine." He doesn't even have any of this end organ damage that is attributable to hypertension. But this is to say that high blood pressure or hypertension is not curable, and we have to emphasize this very well because a lot of people come with that bogus claim. Take this app, take that. It's going to cure it. No, it does. It is not curable. It is, however, controllable. It is manageable. It's something we can treat. But then that's another very important point. Some of our clients would have been on their drugs. They are very well controlled, and they get elsewhere, and this person will say they will measure the BP and it's 127. They're very fine. And they say, you are cured. Stop your drugs. No. The drug is only sitting on the blood pressure. So please.
It has not cured it.
It has not cured it. So you stop the drug. It's just like a spring that you compress. with your in between your hands. As you compress, immediately you release your hand, the print bounces back to its normal. So as you stop your drugs, BP goes back up, and it can be catastrophic. So please, our listeners, one important part of this discussion is that when you have blood pressure, you take your drugs, it's going to control it very well. Don't stop your drugs. When you are well controlled, you keep taking the drugs. And another misconception is that somebody will say these drugs they give in the hospital can cause kidney disease. I had that encounter recently. Doctor, I hope this drug will not damage my kidneys. Not taking the drugs, it's going to put you at risk of kidney disease. In fact, some of the drugs we use to treat high blood pressure, we actually give it to even prevent kidney disease. The drug will as well treat the high blood pressure. But some of the secondary effect of those drugs is that they will now prevent, kidney disease is a complication of hypertension.
Yes.
So they will not prevent that particular complication. They're going to prevent certain damages to the heart. So it is not the drugs that will cause the disease, which is hypertension, that will cause the kidney disease. So let us get it clear. Hypertension is likely not curable, but it's something we can control very well, treat very well. But then someone that has started taking the drug is likely to continue to take the drug until we are giving 3 drugs. We can then decide because you have taken to our advice on lifestyle, we are going to discuss shortly.
Yeah.
So if you have taken to the LD lifestyle that we have prescribed, then you may not require the 3 drugs anymore. We can next them down to 2 drugs. If you are taking 2 before, you can say just one other guy will get. That's how we titrate, we adjust to the body's needs, but we will not stop.
Okay, you've heard it from the horse's mouth. To those of you out there, a consultant, when you talk about a cardiologist from General Hospital Ikorodu, when we talk about hypertension, it is not curable, but then it can be measured, it can be controlled, it cannot be cured. You've heard that already, so do not be deceived. We've heard a lot of cases where some people just come out in the downfall public buses and tell you this one cures it cures everything, including hypertension. That's a lie. You should be aware of that. So let's talk about our lifestyle now. Immediately after this, then we talk about those that are already in this circle of having this deadly disease. But before then, those that are not yet into this circle, how then can we live? How do we maintain our life? What are the do's and don'ts to avoid being in that circle of an hypertensive person?
Thank you very much. What we're going to discuss now is the healthy lifestyle.
Okay.
And the way I've said it is not hypertension lifestyle.
Aha.
It is not diabetic lifestyle. It is not lifestyle for smokers. You understand? It is healthy lifestyle. Leading an healthy lifestyle ensures that you are free of diseases and premature deaths. That's the basic definition of healthy lifestyle. And if one does that, high blood pressure will not come. If it's already there, you may not require as many drugs as possible, and whatever you take is going to make it, and the path to that complication will be very, very long. Do you get that? So that is why the healthy lifestyle we're going to talk about now is going to prevent high blood pressure and make the treatment easier for the doctors and our clients. One is to reduce the amount of salt we take. That is one very, very important point. There is this common joke, and somebody said the African woman typically doesn't measure salt. You will just keep sprinkling in the soup or whatever until one ancestor says, it is all right, my daughter. And of course, they always get it right. That's our mother. Kudos to them. But then gone are these days that will say, just keep sprinkling. Even the ancestors, they are busy doing other things.
They don't have time.
They don't have time to be monitoring salt. So salt monitoring is primarily our own. And that is for an average adult. We say you should not take more than 5 grams of salt.
5 grams of salt.
And that is teaspoon that is leveled. You dip that teaspoon into the salt, it's going to be heaped. Then you cut down the heap part of it. When it is leveled, that is 5 grams of salt. That can then be kept in a small container, and you sprinkle part of that in the morning, part of that in the afternoon, part of that in the evening.
Oh, not that even you did not that.
No, not per meal.
Aha.
Not per meal.
Okay.
It is the entire consumption per day is that 5 grams of salt. That is what that we have said is a teaspoon leveled. You see how because we are Africans, it is said that our forefathers they lacked salt, so our kidneys are conditioned to retain salt. So we have organs that is already retaining salt for us. So taking added salt is not encouraged. So that is what's going to be done in the kitchen. However, when we now get to the table, we should, in fact, salt shaker should not be on our dining.
Wow.
Should not be on our dining. Whatever we have as food is what you just consume. We call that added salt, and that is even more dangerous. That is one that is added from the kitchen. So we are in a restaurant, you have a salt shaker or this like that, avoid it completely. So that is about.
But some people will tell you they enjoy their meal when they sprinkle this salt from their salt shakers to give a beautiful taste and delicious.
There is this common adage in Yoruba setting. Wherever you put salt, water comes to meet it there. You get about see, don't show me see. You get that? So as you eat more salt, you are bringing more water fluid into your system. And that is what will result in this high blood pressure. If you observe, those are the drugs for hypertension. Some of these drugs will make them to pass a lot of urine. They are excreting the sodium, which is what is contained in salt. And as the sodium goes out, water will follow it. So eating a high level of salt is one very important part of this campaign. We should avoid it. And I've also said that we are not talking about the food being tasty. How about certain food that you eat that will not even taste salty? I mentioned that earlier, and this is contained mostly in these highly processed foods. Those ones that we buy in the malls, canned food, highly processed food.
The meat pie, the donuts,
yes,
the scotch egg roll.
Yes, they have a high level, and they will not taste salty. And then to dampen the effect of the salt, they will add a lot of sugar, which again is bad. So that is not one important point. The other point is taking consumption of red meat in excess should be discouraged. We prefer the white one. All categories of fishes are fine. The ones around us, Titus, Cote, and the rest of them, they are fine. The ones that are caught in our own rivers and lagoons, fine. They are okay. But these fishes should not be fried. They are better boiled or grilled.
Not fried.
Not fried. So red meat, it should be discouraged.
For a clearer understanding for those listening, when you say red meat, you talk about the cow meat, the goat meat,
the goat, and the ram. Because I have people that said the red meat is just the cow.
They will tell you it's only cow.
Since ram is actually white, so before is white.
So it's best we go for the white meat, the chicken, the turkey,
the skinless chicken.
Skinless.
Yes, the skin has to be out of it. That makes it healthy. It is the skin that has those terrible fats. There is no type of, maybe generally I would say protein, whether fish or meat, that will not have. They all have cholesterol.
Yes.
And we say there are good cholesterol and there are bad cholesterol. What we say in red meat, that the amount of the bad cholesterol, the bad fat, is actually very high than the amount of the good cholesterol. So, but for the fishes, the amount of the good cholesterol is a lot more than the bad cholesterol. So it's a ratio thing. So it's better to consume the one with very high level of the good cholesterol compared to the bad. And the chicken, the bad cholesterol in chicken is in the skin. That is why we say that it should be skinless chicken.
Okay. Let's move ahead to the next one because of our time. We've talked about the reduction of salt from our meals, and we've talked about avoiding red meat. Then we should do with white meat instead.
Yes, and in addition to that, consumption of vegetable should be part of our diet regularly. Vegetable in whatever form they come. Just look at the one that you are okay with, that will not purge you. Taking with everything I will take, with rice, with beans, with amala, let there be a good amount of vegetable. Then finally, fruits is also very good.
Fruit.
Yes, taking 2 or 3 portions of fruit every day is quite good.
Thank you so very much, Doctor. Before you leave, importantly, what will be your advice to Nigerians, listeners out there that are living with hypertension?
Thank you very much. The advice is to live a healthy lifestyle, and that is everything I have said, plus regular exercise. Regular exercise. What is deemed regular is something you do almost every day. I said almost every day. If it is not going to be every day, it should be almost every day. Like 5 times in a week is a list that you should get of 30 minutes of what we call aerobic exercise or cardio exercise. The one we regularly tell our clients is just move around briskly, walk very fast, and let that be very regular. It can be divided into sessions, but a session should not be less than 10 minutes for it to count as exercise. You want to walk around. It's not the walk of, see me here, I'm there. You walk very fast, very, very briskly. you do that, and that will ensure that you are going to be a bit sweaty and your heart will pump faster. That ensures the small vessels that are not that are collapsed already in your body, they will open up. Doing that regularly will ensure also that you are not big, you are not fat. Eating late at night is another thing that it is not too good. That is one of the things that will actually make majority of us who have that pot belly. Stress is not exercise. Stress can lead to hypertension.
Stress can lead to hypertension.
Exercise will control hypertension. So stress is when you have to meet certain targets. We have to meet target in a specified time. You understand? And that will put you under stress again. You understand? So that is somebody will say, because I'm a bricklayer, because I'm a automobile mechanic, because I carry a lot of things, I don't have to exercise anymore. No, exercise has to be structured. It has to be timed. It has its own frequency. It must be done regularly. The same type of exercise should be done frequently with the particular duration. That is when, and the type of exercise you're going to do that will meet the actual objective. And exercise has its own objective. So this is different from stressing yourself. So whatever you do, you still need exercise. Stress can lead to hypertension. Exercise, when it is structured, when it has duration, and it is regular, and you are following the exact thing we have said about the aerobic or cardio exercise, this will control high blood pressure.
I think the reason the caller asked that question is understandable. We have people in line of duty, for instance, bricklayers and all of these heavy workers. They tell you, the one I'm doing, koja exercise, so I don't need exercise anymore. Please be aware that stress sometimes, in most cases, could lead to hypertension. So, your medical advice to our listeners?
My advice is basically, let us measure our blood pressure accurately. We should control it so that we can live longer. Let us know our numbers. The numbers include the actual value for the blood pressure. The value for the, like I said, a value of more than 140/90 is deemed hypertension. And that should be consistent. If you have measured today, you have measured a day or two after, then it's consistently more than 140/90. That is hypertension. They should come for us to. It is not all the time we give you drugs. Or sometimes we also just do this. Just part of the advice I've said there. And a number of clients, when they engage in this, they pay heed to this advice. See, the blood pressure will come down to a reasonable extent. So that is one important. We should know the numbers of our blood pressure. We should know that of our sugar. We should know that of our cholesterol. And we should know that of our weight and height. That is what we call the BM, the body mass index. So if you do all those ones, so what I want to leave with our listeners is know your numbers, and importantly, measure your blood pressure accurately, control it, and live longer. One of the ways to control is to live healthy lifestyle. Recently, WHO made a release. I think January this year. No level of alcohol is deemed safe. The harm from alcohol starts with the first drop. So consumption of alcohol should be discouraged. These are things that come together that will form a risk factor for high blood pressure.
I want to say thank you so very much. This is my own question to you now, because they say that short people are closer to they say just like you said, he said fat people are of a bigger risk of hypertension. So how about short people? How true is it that they are closer to?
The short people should measure their blood pressure accurately, control it, and live longer. The short people should know their numbers. And that's what we have said. Seeing somebody on the face, I cannot determine the blood pressure. It happens in short people, in long people, in fat people, in thin people. However, know your numbers.
I want to say thank you so very much, Dr. Lookman Kareem, and of course a very big thank you to the entire staff and management of General Hospital Ikorodu. This is how far we can have it today on the issues. Join Victor and of course Gift tomorrow on the issues. My name is Adebambo or Payame. Urging you to stay safe, stay healthy. It's important. Health, they say, is wealth. Good morning and God bless Nigeria.